Okay, so this is episode 2 of my unedited ramblings, and this one's about insurance. As I mentioned in episode 1, I've just had a knee operation to repair a catastrophically torn meniscus. The surgeon's words, not mine. And I was really grateful through the process that I have private insurance through work, because I was able to see a consultant on a Thursday, have an MRI scan a couple of days later, see the consultant again the day after the scan, and then get booked in for a surgery basically within 8 days of very first engaging with the consultant. And that was a consultant that I had researched online who had a specialization in the area that I needed him to in terms of knee repairs, and had worked with professional athletes and things of that nature. So that it's not ideal having a really severe injury, but that process went really quickly and really smoothly, and I didn't have the stress of worrying about the money. And I was reading recently about wait times in the NHS, about how NHS satisfaction levels peaked at 70% in 2010, and then the Tories were voted in, and now satisfaction levels are down at 29%. Now, to be fair, I don't particularly know if I want to make this a political channel, but I would be surprised if that's all government's fault. There's been a lot of other stresses, not least COVID, and people gradually living longer, etc., etc. But having to go through the NHS system at the moment can be an absolute nightmare for kind of non-critical care. So if you have a heart attack or a stroke or something like that, the NHS is probably going to do a great job taking care of you. Obviously, this is really focused for people in the UK. But if you have a kind of knee injury or hip injury, or some kind of joint injury, muscular injury, that's stopping you doing everything you'd like to do, but it's not going to kill you, and you can kind of get by, then you could be looking at years on waiting lists to get that sorted out. And something that only really becomes apparent when you have bad health, when you have injuries, is just how highly you value being well, right? Like, if you're ill, if you're injured, you would do, not anything, but you would do a lot to be able to click your fingers and get back to health. And so I feel lucky that I have a path to that, that's not going to cost me anything, or it's only going to cost me my excess of less than £200. But if I didn't have that, and I didn't have the funds to obtain private care, and I was faced with an indefinite wait, potentially years, before I could even see a consultant or get the scans I need or whatever it might be, that would be extremely dispiriting, because I'm more or less housebound. So that's a very long-winded way of saying that if you don't have private health insurance through your employer, even if you're young and healthy, it's something that I would be looking into. For people who live in the UK, I think it can almost seem like unpatriotic to not want to rely on the NHS, but you're still going to be paying taxes to support the NHS. And actually, I haven't thought this all the way through, but I imagine that if you're getting care done privately, then that's actually taking load off the NHS. So I think it's something that if I wasn't getting through work, I would 100% be paying for. Especially if you're, I don't know, under 40, the cost of getting decent insurance is not that high. I can imagine you probably get something for between £50 and £100 a month, depending on what level of cover you want, which feels like a lot upfront. And it's weird because you're paying significant amounts of money for something that you hope to never use. But looking at it from where I am now, if I was even at the top end of that range, paying £1,200 a year, that's a huge amount of money. But I would pay. I can't imagine where I'd be not having that cover and then not being able to get the care. So obviously, it very much depends on financial situations and what your priorities are. But I think it's worth having that discussion with yourself about, is this something I want to do? How do I feel about that? And it might be that actually you think, do you know what, that's not what I want to do, which is, a completely valid decision. But I think it's better to have thought it through and decided it's not what you want to do than to never have thought about it, for something to happen to just think, fuck, why didn't I think about that?